Hi, everybody. Let me get my slides up here. All right. I'm Carrie Cihak. I'm with my colleague, Maria Jimenez-Zepeda, and we're here to talk to you about King County Metro's impact evaluation of our subsidized annual pass. And we're here in the city of Seattle to share with you some of the approaches we've taken to really center equity in our evaluation of health and well-being impacts of this intervention, which is providing a free fare public transit service to the lowest income people in King County. And just to give you a little context, King County is one of the largest counties in the United States. And we're among the most racially and ethnically diverse counties as well. And by population, we're larger than 15 states in the United States. And for decades, really, King County Metro has been operating really excellent public transit service, a very extensive bus, and we also are involved in operation of a light rail service here. And in recent years, we've been shifting our focus to becoming a mobility agency. And by that, I mean that while we maintain really excellent focus on operating a great system, we're expanding our focus to really think about how we deliver on the outcome of mobility for people in our region, particularly where the needs are greatest. So at King County, we believe in mobility as a human right and transportation as a human right. And that means in King County, we think of access to transportation as one of our determinants of equity, we call them, which are closely related to the social determinants of health. And the things that every person and community needs to be able to thrive. And so in that way, we're trying to address the underlying structural drivers of inequity in our region. And what's, I think, innovative about our approach at King County Metro as a transit agency is that we're focused not just on performance metrics around transportation outcomes, but we're really focused on these big community outcomes. So healthy communities, a thriving economy, and a sustainable environment. And obviously, you know, King County Metro alone can't be responsible for these outcomes. There are many, many factors that influence these outcomes, but we can hold ourselves accountable to how we contribute to those outcomes. And that's what this impact evaluation of our subsidized annual pass is really about. How do we really know that we're affecting communities and people's lives through our interventions, and how do we keep improving upon that as we move through developing these programs and pilots. And with that, I'm going to turn it over to Maria to talk a little bit about our theory of change and the subsidized annual pass program.
Yeah, thanks, Carrie. So in our theory of change, we are working with community on innovative ways to address both cost and non-cost barriers to mobility. We hypothesize that these interventions, systems, and programs will lead to increased public transit use and ultimately to greater mobility. And in turn, this increased mobility increases access that people have to social determinants of health, like affordable quality housing, jobs, education, and access to services. And we believe that ultimately that leads to increased health and well-being for people and more equitable communities. Next slide. And so that's really kind of the foundation for our subsidized annual pass evaluation. Yeah. So how did we choose this population? We were actually evaluating the health and well-being impacts of King County Metro subsidized annual pass. This pass is available to residents whose household incomes is at or below 80% of the federal poverty level and who are enrolled in state cash benefit programs. What this pass allows them to do is ride on Metro and Sound Transit services at no cost to them for up to 12 months. The program itself was designed based on community input and engagement and is operated in partnership with other services agencies, including Public Health, Seattle and King County, as well as the Department of Social and Health Services, who primarily serve this population. Next slide. So in order to support our evaluation efforts, we are relying primarily on two sources of data, surveys and administrative data. Metro's administrative data is primarily smart card use and is what allows us to evaluate the short-term outcomes of transit use. We are also working with the state of Washington for administrative data that can help us evaluate those midterm outcomes that we were talking about, such as employment, income, access to preventative health and other services, as well as treatment adherence. Since we are doing a pretty innovative project and going beyond just increased mobility or even increased economic outcomes and really trying to make that impact on health and well-being, we are relying on surveys to be able to help us make those evaluations. And so those help, the surveys allow us to evaluate long-term outcomes on health and well-being through validated measures of psychological distress, physical health, and loneliness. Because we are really prioritizing the surveys in order to try to understand those outcomes, those surveys are available in multiple languages, in multiple modes, and are compensating participants at $50 Visa gift card in order to encourage participation in compensating participants for their participation in the survey. Next, over to you.
All right, I'll talk a little bit about how we're going about doing this in partnership. So at King County Metro and in King County more generally, we really strive for an equity and evidence-based practice in our research and evaluation work that leverages these three kinds of expertise that you see here. So first, the expertise of our clients and communities, not only regarding their needs, but also really helping us to focus on the outcomes that are important to them and in working together to co-create and design solutions. And I think often, in our work as governments around North America, we tend to not value this kind of expertise as much as we need to. And just like we pay consultants, staff, and other experts, we really need to have a practice of compensating community for their expertise as well. Second, our own staff and staff in other government agencies that we're working with bring a ton of system, organizational, and institutional expertise. And having the program staff as equal partners in research and evaluation is critically important because it helps to make sure that the results of this work, this evaluative work, are really put to use in decision making. And that's not only the decision making that happens kind of at the end of an evaluation, but it really, having staff involved really encourages a lot of continuous learning and along the way in the process. And then third, of course, we're working with external researchers and experts, and they're essential partners in advancing equitable evaluation. We don't have health researchers on staff at King County Metro yet, anyway. So we've really sought to bring in the kinds of expertise that complement the expertise of our staff and our research staff. So we have a really robust partnership with actually 3 different academic institutions on this evaluation. The University of Pennsylvania Perelman School of Medicine is providing a lot of expertise around how we measure health impacts, what kind of effects we should expect to see from this intervention. And then we are also working with the University of Notre Dame, who's bringing a lot of expertise around some of the economic outcomes, as well as some of the methodological approaches. And then we also have a researcher from University of California at Irvine, who's just rounding out that team. And together, those researchers are really helping us understand that theory of change that Maria discussed, and that's helping us really understand what our contribution to those outcomes can be and to hold ourselves accountable to those. And I'll say that a really important aspect of these partnerships is that they have to work democratically and equitably together if we are going to be successful. So if any one of the partners doesn't respect the expertise of the folks in the other two domains, we really can't function well to create equitable evaluation and outcomes. So when we're looking to partner with researchers, we're really looking for people who not only have the technical skills, but also bring that democratic and equitable approach with them as well. So we'll turn to some lessons learned thus far. So I've already talked a lot about that collaboration across different types of expertise. Partnership with community-facing organizations is really essential. Of course, Metro has our own relationships with the communities we serve, and we're also really working closely with those social service organizations to meet people where they're coming already, so that they're not facing extra barriers in getting access to these services or participating in our evaluative work. And then really taking not this approach of, oh, we're going to do an evaluation and in 2 years we'll get the results, but really, how we're really working to learn along the way. So, for example, we're just in the process of completing the baseline survey of the 2,000 or so people who are participating in this project. And we intend to really dig into that, the information in that baseline survey to understand what's happening and think about how that needs to affect what we're doing right now, not, a year or so down the line. And then, I'd say, evaluation is hard. Evidence building is challenging, particularly when you're working with populations who have a lot of other things going on in their lives and have maybe less kind of resource to pull on to get what they need in their lives. So it really requires a lot of adaptability, adaptability on timelines, adaptability on budget, adaptability in approach. And you've really got to, have everybody who's involved in this work engaged in some joint problem solving. And that's particularly true if you're really trying to center equity in your evaluation and research work. It requires really significant time, planning, and resource. And it's not just things like Maria mentioned, like translation, but also that trust building with communities that's so important. And then I'll also say that, I think a big lesson we're always working on is that decisions that make for the best research project are not always the decisions that best support equity. And so to be engaged really truly in equitable evaluation practice means that everyone involved really has to be centering the needs of the people who are the study participants first, and then figure out how we approach the research work. I'll turn it to Maria to add some of the lessons she's learned as well.
Yeah, thank you, Carrie. I think I would just want to elaborate maybe on giving a couple of concrete examples of what some of the lessons that Carrie's identified so far. To this last point, one of the things is when we were originally planning on doing an evaluation, as from a research perspective, we thought, well, as people are getting enrolled in this program, we can invite them to participate in the evaluation. And have them do this, this survey, this 20, 30-minute survey. It's easy, it's efficient, will work great. And one of the things we actually learned from, again, this partnership with our community and with the social service providers that actually wasn't the best approach. We really wanted to have trust with community that at the time of them enrolling in these services, they may have just answered a 30 to minute to hour conversation on their own kind of information, health and well-being to get access to those cash benefit programs. And so being able putting this additional kind of mental load on them was not necessarily going to be as conducive as we thought. And so we honored that expertise from our community and service partners. As well as another thing I want to highlight about kind of that adaptability and joint problem solving is one thing we learned is that evaluation is very messy, a lot more so than we thought. One of the things was we didn't realize how often people might change their names or date of birth from one survey to another. And so having to then retroactively identify how do we make sure that we are tracking participants and their survey responses over time, and maybe how can we build in some of that work a little bit more so to make that possible, and really being able to communicate with customers and participants in a very responsive and timely manner. I think I heard communication brought up earlier, and that is incredibly important because as so many things that we learned, we're like, we didn't know this was something that we should expect. Cases were so much different than we would have expected, and just being able to be adaptable and responsive and primarily focusing on centering participants and making sure that they have a good experience, not just with the evaluation, but also with everything that we are promising them for their participation.
Great. So here's our contact information. We're happy to take questions now or have folks connect with us if they want to learn more.
Thank you so much for presenting on this. This seems really cool. So questions. I know one question I had, again, while we kind of wait, did someone have a hand up? All right, Matt? Yeah.
Maria, I really appreciate you bringing up the example of sometimes people are just tired of filling out forms. And so you took that on board. I definitely have heard the same feedback here in Toronto. And I wanted to ask what other kinds of evaluation methods, do you think are more energizing, and sort of what happened with that example? And also, have you explored like other, I don't know how to phrase this, but sometimes it's like we're asking people to give us data for an evaluation that they've already given to our partners, but it's under some kind of lock and key. But if we could do that, then we reduce the evaluation time and we get maybe good results. And have you looked at other forms of data sharing with partners to try and get at that, or sort of what other kinds of strategies have you thought about deploying just based on your experience?
Yeah, I think you have a two-part question. I think Carrie is more equipped to answer the second part with other research projects, actually maybe beyond this. But for the first part, one thing that we did was actually separating the evaluation from enrollment, just making that completely separate. And even for the evaluation, we first have a really short screener to find out if they're even eligible. Then if they are eligible, then we invite them to complete this longer survey with guaranteed compensation. So it's still not the most exciting. There's still a form to fill out, but at least they know that they are getting a guaranteed $50 gift card for it. And we are also trying to supplement this with qualitative evaluation. So we will be doing a number of interviews and conversations with participants next year to help us better understand the results that we're seeing from these surveys. And then I'll pass it to Carrie to answer about the data sharing and evaluation.
Yeah, I think something critically important in this work has been our partnership with our public health department and the Washington State Department of Social and Health Services. So we're all serving the same people, and we all have the same, desired outcomes that we're trying to help people achieve. And so from that, shared set of interests, that's really allowed us to think about how we can unlock a lot of that administrative data from the state. So we don't have to ask people in a survey about their employment history or their income or other kinds of things like that. We're going to rely on a lot of administrative data from the state, excuse me, including even, things like how often are people accessing their preventive health benefits? So we're only asking people in the survey things that we can't get through other data sources, and that has dramatically reduced the length of the survey. And then, I also think that, offering the survey in all those different kinds of languages and in different modes really, helps people to feel as though we are, doing our part to kind of make it as easy as possible for them. So, there's a whole variety of ways in which we're, really trying to address those issues.
Thank you.
I want to ask a follow-up question on that, like getting the state to share the data. I mean, it just seems like there'd be all sorts of barriers to that. It seems awesome. I mean, what you're describing seems great. I'm just curious, what did it take to get to where the state was comfortable with that and legally you're allowed? And
well, first of all, we're super fortunate to have a really motivated partner at the state, who he's the person who runs all of the benefit centers in King County. And so he knows how much transportation has been a barrier for the people who he and their offices are serving in just accessing the benefits that they're providing to people. So there's a lot of motivation at the state to really partner with us and understand how we can do a better job of being able to get people to where they need to go when they need to get there. And really, we're not really thinking of that partnership as, a one-time, for this study type of partnership. We're really trying to build very long-term engagement with the state, because the state's providing all sorts of benefits here in King County, through the transit system. We're providing benefits, but we're also doing it through our homeless programs and through our mental health programs and through our public health programs. So, all of us are really, providing lots of different types of services to the same people. And so there's been a lot of motivation. That said, it isn't easy. We've had to go through both like academic institutional review boards for approval, and then Washington State has their own institutional review board process that we have to go through to access data. So that adds a lot of time and, sometimes conflicting direction. Just it requires a lot of work with people at the state, not only the people who are delivering services, but also the people who are delivering data, and really like spending a lot of time building that relationship and, really thinking carefully through what exactly are the data points that we need and how do we do it in such a way that we're protecting the privacy and the security of the data.
thank you so much. Thanks for coming and making this presentation and telling us about what you're doing. Our next presentation is Transit Access Project, Free Public Transit, Intervention for Youth Experiencing Homelessness in Toronto by Noah Kelly of the University of Toronto.